Claire Middleton. Kate Hyder. Charlie Wells. Charlie Welton, Liberty left parent / and right parent has joined the meeting. The host has spotlighted your video for everyone.
Welcome, everybody. Lovely to see you. Lovely that you're here with us.
Margaret Jacob. Ali Murray.
Hello, good afternoon.
Marie Anderson.
Hi there, Robert. Hi, how are you?
Hello, nice. I can't see anybody. Are we supposed to be seeing you or?
No, that's okay. I think I've spotlighted our two speakers today, so I'll just be in a floating around in a little box somewhere on the
Thank you.
On the side.
Thank you for all your kind help. I can hear a little a voice in the background, so I wasn't too sure what that was. Thank you.
Pleasure.
It's probably my screen reader, which has got a very horrible automated voice.
Oh, hello there.
Hi, I'm Fazilet. Very good to meet you.
Nice to meet you, Fazilet. Don't worry, I fully understand. I'm partially blind myself. So,
okay.
So it's no problem at all.
Thank you.
It's to be expected these days. Not so I certainly would not expect it. You know what I mean?
Yeah.
Thank you.
Lovely. And Annette, whenever you're ready, I think that we're ready for a lively and interesting discussion.
Hello, everybody. It's great to see so many people here. At least I can't see most of you in the sense that you're not showing your videos, but I can see that there are a lot of people here, which is wonderful. And I'm Annette Lawson. I'm going to be facilitating today. Just to say a couple of housekeeping words about what we need in order to facilitate you better, is that could you please, if you're capable and you can do it, if not, obviously, you'll use a different method. But if you can, use the chat to put in any questions you may want to place yourself or somebody else to do it for you, please use that. Otherwise, make sure you raise your hand at the right times when we're taking questions so that we can see you, and or alternatively, just call out and we will try and pay attention to you and get you to ask your questions, because we really do want you to be able to participate as much as possible. I'm here because I had a doubly disabled sister. We were just 2 years apart, so I, from the age of 2, had a sister who had learning disability. Not actually that serious, it could have been much worse, but she never understood number, which is quite handicapping in a world like ours. And then when she was adult or late adolescent, she developed very serious mental ill health. She had schizophrenia and never lost her voices. Mind you, they weren't unpleasant voices, they weren't dangerous voices. She found them kind of comforting, but it meant that it was very difficult to have conversations with her, because she would go into these trance-like states where she was listening to other voices. And for most of her life, actually, following a number of very serious breakdowns, she did live in both a hospital, a psychiatric hospital for some time, and at the end of her life in a residential home for Jewish people, quite a big one, in which you may know, called Nightingale House. It's now combined with something else and has 2 houses, where she was actually very happy. And she died in on September the 4th, just yesterday was the anniversary of her death in 2019. And I don't know how many of the people in the room have suffered particularly during COVID. I mean, especially hard, especially if you lost somebody close to you. I'm just hugely grateful that Judith didn't live through COVID, because I don't think she would have understood. And if she did understand, she would have been terribly upset by the fact that we couldn't visit her, and she certainly didn't have a room. That place didn't have a room with a window that you could even talk through. So that would have been extremely hard for her. And she was pretty ill at the time she died. So in a way, I think she and maybe we were lucky that didn't end her days, as it were. So I am an activist feminist. I've been and still I have the title of ambassador for René Cassin, but I also have that same title for the National Alliance of Women's Organisations, and have worked for a very long time on gender equality, as in women and girls equality with men, in accordance with most of the UN conventions that we work with. So I'm very delighted that our trust was able, it's really a foundation, to give money, and is still in process of giving grants to René Cassin, because it does stand for human rights, and it has a program for women's equality, within which our special interest, the Judith Trust special interest of working with people who have both learning disability and serious mental ill health. So today's meeting is part of the work that René Cassin has developed, called the Judith Social Justice Project, and there have been a number of extremely interesting meetings so far, and more to come. This is absolutely on the spot, looking at Disability UK through our wonderful speaker, Fazilet Hadi, looking at what the situation is right now in our own country for people of all different kinds of disabilities, everybody who has some kind of difference that makes negotiating life in our sighted, hearing, meritocracy that we, hopefully democracy that we live in. The reason I've told you quite as much as I have about Judith is because I don't want us to leave behind those who really wouldn't even be fit enough to do a Zoom or to come to a meeting like this and have their interests in today's society recognised, because it costs a lot of money, as everyone knows, to look after people in the way they should be looked after, in line with their human rights, in institutions of many different kinds. And some people do need that kind of support, and I hope that we can include them in our thinking. So what we're going to do is, I'm going to invite Fazilet to maybe say a few words about yourself, Fazilet, but you've had an extremely distinguished career, still having an extremely distinguished career, and people might like to know more about you, and then to lead us into what you're going to say and what you're going to focus on today. So Fazilet,
thank you so much, Annette, and lovely to meet you all. And if you do hear a funny automated voice, it's my screen reader trying to interfere with my train of thought, which is highly irritating, so I apologise. So I'm Fazilet Hadi. I'm head of policy at Disability Rights UK. And just to tell you a little bit about myself, as Annette suggested, I began to lose my sight when I was about 9. I have a genetic condition, and up until then I'd done everything. I'd ridden bicycles and read avidly and, played in the same way. In fact, it was my mum who noticed I had a sight condition, because she saw me reaching for some toys and not quite grabbing them. And for some people with my condition, it doesn't begin to affect them till maybe their 40s or their 50s. It's a degeneration of the retina. It's a bit like macular diseases for older people. But for me, it was very aggressive from about 9 into my 20s. So by my late teens, early 20s, I was registered blind. So I had light perception, but I couldn't read. I began to not be able to see colour. And to give you a sense, like when I was doing my A-levels, I wrote the answers with a black felt tip. But by the time I was doing my Law Society exams, I was dictating my answers. And I say this because when I look back now, during those years, I was so self-conscious. I know all children are, no one wants to be different. But I was excruciatingly embarrassed about my condition. I didn't want people to know that if I could hide it, I wouldn't talk about it. And I think the reason this is important is because when I actually was able to feel more comfortable with who I am, when I was able to use a white cane, when I was able to ask for assistance, when I actually realised that it was the world that needed to change, not me, which we call the social model of disability, that gave me a huge relief because I felt like I'd been carrying the burden myself. But once you think that actually the world will always include people who can't see properly, it will always include people with learning disabilities, it will always include people with other impairments, health conditions that maybe make life difficult in some ways. One thinks, well, if we all knew that, why don't we design a society that actually includes us rather than make us feel that we're on the outside looking in? So I became a lawyer. I was a solicitor in law centres for just under a decade. I worked in local government as an equalities officer. I spent many happy years at the Royal National Institute of Blind People as a director. And I'm now head of policy at Disability Rights UK, and I also am a non-executive member of an NHS trust. So what I want to talk to you today about is the inequalities that disabled people have faced through the pandemic and continuing today. I'll tell you a bit about Disability Rights UK. I then want to cover some of the big public service issues that really hit disabled people hard during the pandemic and ongoing. I want to talk to you about breaches in the Equality Act that we thought maybe was more embedded than it was until the pandemic came. And I want to talk to you about the cost of living crisis. And what I have to say is quite bleak, but there is always hope, and I am hopeful because firstly, you have to be, because I'm sure all of you want to change the world for the better, and it's great having allies who want to do that. But secondly, because disabled people have been fighting for their rights, for equality, for justice, for centuries, you know, as have ethnic minorities, people of different religions, women. And, you know, I feel we come from a proud tradition of disabled people fighting for justice, and we have made headway. So even though I'm going to paint a bleak picture, we have made progress. And there's a very good BBC programme actually called The Secret History of Disabled Britain. I don't know if any of you have seen it, but it talks about the workhouses in the 19th century, the institutionalisation of disabled people in the 20th century, and the fight for equality through the 1980s and 90s. So let me just start with something about Disability Rights UK, where an organisation that is about, it's sort of what it says on the tin really, we are about the rights of disabled people. We are led by disabled people, which means that the majority of our trustees and the majority of our staff are disabled people. So we speak with some authenticity about the issues facing disabled people. We believe in the social model of disability. Of course, medical treatment and clinical treatments are important, but what we're really concerned about is the world being designed with disabled people in mind, and that means attitudes, it means policies, practices, institutions, environments and information. So, you know, we're really concerned about, well, how do you get a world where disabled people are fully included? We're not extra, we're not additional. About a fifth of the population that are disabled people, we're here to stay. We're not going anywhere. In fact, we're probably getting a lot bigger. And throughout the pandemic and throughout Disability Rights UK 10-year history, as we celebrate our 10th anniversary this year, we very much speak out and speak up on the rights of disabled people. The United Nations Convention on the Rights of People with Disabilities and the Equality Act are kind of touchstones, if you like, of what good looks like. Disability Rights UK works to influence government policy. It also works to empower disabled people, and it works to build alliances within the disability movement, but also with allies, because we're stronger together. So now let me talk to you about some of the service impacts of the pandemic on disabled people. It started pretty badly, actually. I can really remember that March 2020 pretty vividly. And towards the end of March, the government brought in a bill called the Coronavirus Bill. And a shocking part of that bill, I found it utterly incredible, was the reduction of rights for disabled people. So basically that bill provided that our rights to social care could be reduced, our rights to education could be reduced, and our rights to mental health protections could be reduced. So that was a very, very bad start to the pandemic, because as opposed to hearing about what was going to be done to support disabled people, to give us added support, added protection, we heard about what was going to be taken away. That was followed very, very quickly by something called the National Institute of Health and Care Excellence, bringing out guidance on access to critical care, which linked to something called the frailty scale. And on the frailty scale, basically, the more points you got, the more you were deprioritized for critical care. And needing support at home gave you more points. So it was actually saying if you needed support at home, then you were deprioritized. And within 5 days, the National Institute had withdrawn that guidance. But nevertheless, the fact it came out and the fact that it was promoted, and it was left, we were left feeling that our lives weren't valued equally. NICE actually did say that that frailty scale didn't apply to people with long-term disabilities, but I don't know, the fact they brought it out at all, as I say, left a bad taste. That was followed in, I think, in weeks by press stories that GP practices were sending out blanket do not attempt resuscitation notices for people in residential homes to sign en masse. Again, the Care Quality Commission very quickly, and the BMA and others, came out in opposition of that, said it was totally wrong. But it happened. So at this point, disabled people were feeling very, very anxious about where they stood in the health service and were we going to get equal access to care. And many organisations and thousands of individuals signed a statement really asking the NHS whether we were going to be treated equally under the NHS constitution. And the NHS did respond by sending out some guidance to all trusts of saying that disabled people were protected by the constitution. But all this was happening, if you can cast your minds back, at a time when people were incredibly scared about this new disease and how it would impact them. And even though with a bit of pushing, some of these institutions got on side with disabled people, the fact we had to push at all said it all really for us. So we really struggled, I think, at that point to believe that we would get equality in terms of healthcare. And I think there will be stories coming out in the COVID public inquiry that really elaborate and elucidate what I've just been talking about and put a personal face on it. The other big service issue I wanted to touch on that again happened during the early days of the pandemic was the complete lack of attention to social care. In the early days, the government very much talked about plans for the NHS, but it didn't talk about plans for social care. In fact, it took the government 5 or 6 weeks to bring out their social care action plan. And by that time, people with COVID had been moved into residential care homes. Carers who both paid and unpaid carers hadn't got access to testing or PPE and were going into people's homes. People who use what's called direct payments or personal budgets to pay for their own care were left without any guidance on how they access PPE or testing, or how they could get support from social care services. There was a real delay in social care stepping up. And at the same time, we, Disability Rights UK and Liberty and Inclusion London and Mind were trying to make sure that the Coronavirus Act wasn't implemented in terms of reductions to social care rights. In fact, 8 local authorities did implement the Coronavirus Act, and others maybe implemented it, but not to the same extent. The Secretary of State for Education, which I'll come on to in a second, also implemented the provisions on education. But so on social care, we had disabled people not getting the care they needed, having their care reduced, and actually those who did get care maybe not having it with the right protections in terms of PPE and testing in place. So that was, if you like, the second service failure. Health and social care are incredibly important services for many millions of disabled people. The third service failure was around education. As I've mentioned, the Secretary of State for Education between May and July 2020 suspended provisions of that related to special education, i.e. the education, health and care plans. So a small percentage of children, but children with very severe needs and definite need for additional support, have these education, health and care plans. And basically the Secretary of State said that, you know, if local authorities couldn't implement them, that's completely understandable, leaving parents and children in no man's land, really, without knowing where to turn. And there's a lot of evidence that parents with disabled children during those early months of the pandemic felt utterly isolated and alone in supporting their disabled children. No education, because the online education didn't work for them. No therapies, no additional support of any kind. And I think, again, I hope that really has a spotlight put on it in the inquiry. I mean, sad to say that, I mean, none of those services were perfect before the pandemic began. They all were made worse by the pandemic, and they've all continued to have huge issues now. And these are three services that disabled people and disabled children depend on a lot. So with health, we see the growing waiting lists and the disproportionate impact for some disabled people on those waiting lists. People with learning disabilities particularly come to mind, because we know that their options for health are often not as good as for the rest of us, and languishing on a waiting list probably is definitely not good for people with learning disabilities. So, you know, I think some NHS trusts now are really being a bit more active in monitoring their waiting lists, triaging their waiting lists to check that, you know, there aren't disproportionate impacts for people who are on those waiting lists. But that is going to, you know, be a situation we find ourselves in for, I think, the foreseeable future. On social care, we have the Association of Directors of Adult Social Services, every 6 months bringing out a report talking about the hundreds of thousands of people waiting for assessment or waiting to be seen in the first place. And that list just grows ever longer. And we all know that, you know, finding carers is very difficult now, as there are other jobs that pay a lot better, and that social care just does not have the investment it needs. So a recent report, Parliamentary Select Committee report, said that social care needed an additional £7 billion per year. So you can see how far away we are from providing a decently funded and delivered social care system. And on education, the government came forward with plans this year for kids with special education needs and disabilities, but really those plans were tinkering around the edges. They're not going to radically reform our schools and make them inclusive places for disabled children. They're going to adjust some of the forms we need to fill in, limit some of parents' rights to choose what schools their children go to, etc. So, you know, I don't think there's going to be any green light at the end of that tunnel either. So I think those services, I'll come on to benefits later, but health, social care and education all experience sort of disabled people really experience their withdrawal, their reductions, maybe for the last 12 years, hit even harder during the coronavirus period, and still being hit hard by reductions in investment and in service delivery for those really key areas where some disabled people need additional support. So let me talk to you about Equality Act. When the Disability Discrimination Act came into force in 1995, it was a bit of a victory for disabled campaigners. And, you know, that legislation came into force 20 years after the Race Discrimination Act and the Sex Discrimination Act. So you can get a feeling there of how hard and long disabled people fought for that legislation. And in 2010, the provisions of the Disability Discrimination Act were pretty much incorporated into the Equality Act. And I think the key provision is that, of course, there shouldn't be discrimination against disabled people, but more importantly, there should be reasonable adjustments made. And not only reasonable adjustments made by service providers and employers, but there should be there is an anticipatory duty. So you've got to assume that you are going to have disabled employees, you are going to have disabled customers. You don't have to wait till one walks through your door. You can make that assumption, and you should adjust your services accordingly and enable people to access your services in ways that suit them. So really important act. So what happened in 2020, 25 years after the Disability Discrimination Act, did we see that the Act had been really well embedded into society and into the way the government made decisions and into the way institutions, private and public, behaved? Well, unfortunately, the answer is no, we didn't. We saw government regulations on coronavirus come out without an understanding of the reasonable adjustments that needed to be made. One of the early examples of that was everyone can only do exercise once a day outdoors. Well, immediately the government was taken to court on that one and conceded that, for some disabled people, that was completely unrealistic. They needed to get out much more than that. There was a good example, actually, of a reasonable adjustment being made, and that was to the regulations on face coverings, where there was quite a comprehensive list of reasons why you didn't need to wear a face covering, and that included sort of physical and mental conditions that made it very, very difficult for you to wear a face covering, or the need to lip read. But the problem with that, even though the reasonable adjustments were fantastic, the promotion and communication of those adjustments was poor, which led to many, many disabled people being harassed on public transport, in retail environments, because people didn't understand that reasonable adjustment was a legal requirement. Shopping, we found that in the supermarkets, in their rush to support people who are on the clinically extremely vulnerable list, which is very laudable, in their rush to support that group through online deliveries, supermarkets really just stopped deliveries to disabled customers who'd relied on those online deliveries as a reasonable adjustment, because they couldn't go to the stores. And we found that in-store assistance was also stopped. So for his sway the disabled population, supermarkets just stopped making any reasonable adjustment, either in terms of online delivery or in-store assistance. And in fact, in the autumn of 2020, the Equality and Human Rights Commission actually produced guidance for retailers on the Equality Act. Again, we're talking 25 years after the Disability Discrimination Act, because they were patently, in breach of the law. We saw breaches in the street environment with alfresco dining taking over our pavements, but little thought given to how disabled people with mobility issues or sensory impairments would get by the table and chairs. We saw disabled parking bays being requisitioned for alfresco dining, and actually kind of a bit of a Wild West on the street environment as planning laws were relaxed. And yes, not enough thought was given to the Equality Act provisions. And then on accessible information, incredibly, the government, in its wisdom, decided that it did not need to provide a simultaneous BSL interpretation of the coronavirus broadcasts. I'll never really understand why that decision was made, especially as Scotland, Wales and Northern Ireland all managed to have a BSL interpreter. And it took till last summer 2021, for the High Court to rule that the government was in fact in breach of the Equality Act, which any of us could have told them in April 2020. But I think that was one example. There was also an example of a blind woman who was on the clinically extremely vulnerable list, but continued to get letters in standard print, which she couldn't read. So that was another example of the Act not being implemented in terms of accessible information. I mean, these are, you're probably all thinking, wow, you don't need to be a rocket scientist to implement the Equality Act. But I think in tough times, it really showed us that although the Act is there, it wasn't being implemented. And one of the difficulties for us as disabled people is that implementation falls on us. So it's amazing disabled people that take the government to court, or take a supermarket to court, or a train company. And really, should that burden on implementing the Act fall on us? Well, no, it shouldn't. You know, there needs to be much more thought given to how the Act is enforced, and we shouldn't be the ones enforcing it. You know, we've got enough on our plate. So the Equality Act continues, you know, to be breached. I mean, at Disability Rights UK, we probably get calls pretty much every week. So-and-so wasn't allowed into a restaurant with a guide dog, so-and-so couldn't get into a nightclub with a wheelchair. And so it goes on. The move to digital communication is fabulous for some disabled people. It's disenfranchising and excluding for others. We've recently seen plans from the railway companies to close ticket offices. Again, the idea that we all engage online, but actually that is not true. There's a lot of disabled people and older people who need the support of people in those ticket offices. And in street environment terms, we've seen cities like York ban blue badge vehicles from the city centre, which in effect will just exclude some of their disabled citizens being ever able to go into the city centre. And we see those schemes popping up, and with very little thought given to what is the exemption, what is the exception that should be made for the disabled person who has no other way of getting to that city centre apart from either driving themselves or being driven. So the third thing I just want to focus on is the cost of living crisis. You're probably all thinking, gosh, Fazilet's talking too much, but I will end soon and then we can have a discussion. You can ask questions. So on the cost of living crisis, I just wanted to say that going back to the pandemic, the government, it gave everyone on universal credit between April 2020 and October 2021 an additional £20 per week. It did not give that additional £20 to almost 2 million disabled people on what's called legacy benefits, employment and support allowance and other such benefits. It said that it didn't have the IT systems that could do that. I mean, you know, I don't know what to say about that, except that's still going through the courts. It's being challenged by disabled people. But today we find ourselves as disabled people, 7 million out of the 14 million people in the greatest poverty as defined by Joseph Rowntree are either disabled people or have a disabled person living in the household of the UC, of the benefit recipient. So 7 million disabled people live in households out of that 14 million that we're talking about. So live in households with disabled people. I mean, that's huge if half the people in poverty are disabled people or living in households. So we also have a disability employment gap, which is the difference between the number of working age non-disabled people that are employed and the disabled people that are employed. So about 82% of non-disabled people of working age are employed, and the figure for disabled people is 52%. But that masks some impairment groups that have much, much lower employment rates. So people with learning disabilities, autistic people, blind people, these are all groups that have employment rates that are, you know, are shocking. Certainly learning disabilities, 6% are employed, autistic people, 23%, and certainly blind people, the figure, this is for people who are registered blind, sort of 1 in 10 in jobs. So this is also leading to the cost of living crisis hitting disabled people, millions of disabled people, very, very hard. We already have additional costs, and Scope estimates them to be almost £600 a month. And that isn't covered by our benefits, and it certainly isn't covered by the extra cost benefits. And now, you know, if you do a calculation, our extra cost benefits will be eaten up by energy, never mind anything on our additional needs. So the maths just don't work anymore. We have disabled people being the largest users of food banks. We are, a lot of us, quite large users of energy, because maybe we need to keep our homes warmer because we're less mobile. We might be on ventilators, we might use hoists, we might have to charge wheelchairs, we might have to do more laundry, you know, just depending on your impairment or health condition. It's not like having energy is a luxury, it's a necessity for staying healthy, staying well, staying alive sometimes. The government's package of measures doesn't touch the sides really. So we find disabled people really, really up against it now, not just with public services failing, not just with the Equality Act not being implemented, but with us just not having enough money to really make ends meet in any dignified or decent way. So just to finish, I mean, I think it is a really, really bleak picture, and I want to pay tribute to the disabled people that campaign individually, advocate for people who advocate on behalf of disabled people, families and friends, for the allies at the moment that are coming out in support of more targeted help for disabled people, whether that's some of the think tanks, some of the organisations that give food, some of the anti-poverty organisations. I think one of the, you know, one of the sort of, if I can point to any bright spots, is that there are a lot of allies now. It feels like there's not only disabled people's organisations, but allies that really get it and really want to see disabled people get the help they need through this crisis. I think also there are more people identifying as disabled. I hear more people happy to call themselves disabled, and I know a lot still aren't, and that's fine. You know, if you don't want to use that label, that's fine. But actually it does help in a way to bring collective strength to use a shared label. I think the COVID public inquiry is really, really important. And I really want the voices, the stories, the experiences of disabled people to really kind of be heard through that inquiry, so that we really try and learn what went wrong and how we can do things a lot better. And then finally, you know, we are 2 years away from a general election. That feels like an eternity at the moment, but we do really need to work with all political parties to really help them understand that the 14 million disabled people need a whole lot more in terms of inclusion than they're getting, and really work with those parties to see if we can't have something more radical, more ambitious in a future parliament. And I suppose I just pay tribute to end with to all the disabled people across the ages that struggle, and people at this meeting will recognise that, you know, whether it's the struggle of Black people or Jewish people or women or disabled people, you don't win the fight in a year or 2 years or 5 years. It's a long old struggle, but it is good to be part of that struggle and add to the voices of the past and know that there will be voices in the future. So thank you for listening, and I'm happy to discuss anything or answer any questions. Thanks, Annette.
Oh, Fazilet, what a fantastic introduction, and how really overwhelming and I don't know, sad making that we've reached this point where even in extremists, where you might think people's eyes would be open wider. I mean, even if you're blind, your thinking goes that way.
Yeah.
You know, instead of which, it seems from what you've said, everything narrowed, everything to do with disability. And just because I've been interested in this, I do know some of what you told us, but hadn't taken in quite as in that lovely broad way that you did, the various areas where people were so badly impacted because they had some kind of disability, and really betrayed, I think, the sense of those parents being without the support, already shattered and reduced lives, made worse in this way, both for the disabled person in their household or disabled children or child, and for themselves. So if I may, I was given permission by Rachel to pose the first question. And before I do, though, there is something I want to tell you all about Rachel. She has been the person who has put together this wonderful series of meetings that we've had under the label, in a way, of the Judith Social Justice Project, but also in René Cassin more widely for human rights for all kinds of groups. And it is her last time at one of these meetings, or maybe she'll come to one, but the last time that she'll be organising it, because she's moving on to do her doctorate and won't be with us in terms of organising. So I also want to pay tribute to Rachel for organising this, finding such a wonderful speaker. Maybe we'll give her a round of applause at the end. But meanwhile, since you've talked about mainly either the lack of government intervention when it was needed, or its interventions that weren't meeting the needs that were actually truly there. We know now that Liz Truss is going to be our next Prime Minister. She's got one more day. What would you, I mean, you no doubt are campaigning. Maybe there's already a letter in her intro. Yeah. Would you like to share with us what your priority asks are?
I think you're right. I think that there are already a couple of letters that we and others are drafting, because I think one of the things a lot of us have learned through the pandemic, or had reinforced during the pandemic, is about acting more in concert and collectively. So there's one letter which will really ask Lynn Truss, it's all related to the cost of living crisis. It will ask her to increase benefits in line with inflation from this October. So there was a 3.1% rise in April. Inflation's now 10.1%. By the time October comes, I don't know what it'll be. And you know, that is such an obvious first step. Don't wait till next April. It is, you know, just give people more money in their benefits straight away. Linked with that, and that means all benefits, including extra cost disability benefits, universal credit, everything. Linked with that, give more targeted support to the poorest disabled people. And linked with that, make sure that charges for social care, so it's all very technical, but make sure that the kind of, it's called the minimum income guarantee, that is the amount of money that disabled people should be left with after you're charged for social care, is increased, and that disability related costs are also increased. Because actually, you know, there's no point government giving universal credit on the one hand and local authorities taking social care charges with the other. So those will be the financial asks. And there'll also be asks around, for energy companies, around making sure no disabled person is switched off, particularly those using prepayment meters. and making sure the tariffs for prepayment meters are the same as for other energy consumers. And then I suppose for the social care, we'll also write around the minimum income guarantee for social care charging. So I think what's uppermost in our minds at the moment is the cost of living crisis. Having said that, we're also very concerned about the pause that's been put on the National Disability Strategy. So last July, the government launched its National Disability Strategy, which was a kind of list of annual actions that different departments were going to undertake. It wasn't really a strategy and it wasn't ambitious, but it was a one-year plan, and some of the stuff in it was good. Disabled people took them to court on the basis there hadn't been proper consultation. The court found in favour of disabled people. The government is trying to appeal that decision because it obviously doesn't like being told its strategy is unlawful. And so one of the other things we're trying to say to the government is, please don't worry, don't bother about appealing, don't waste another 6 months or a year. Let's just renew the disability strategy, create a new one, but this time let's genuinely co-produce it with disabled people.
Okay.
Annette,
thank you.
Oh, yeah. Sorry, Annette, I'm just going to jump in if that's okay, just because I'm just keeping an eye on the chat.
Yeah.
And I just wanted to relay, and Greg, I see your hand and you'll be the next question. I just wanted to relay to Fazilet and to everyone just a couple of lovely pieces of feedback we've had so far on your presentation and on the broad work of Disability Rights UK. Robert, just congratulating you for your excellent job and the team at Disability Rights UK, and mentioned specifically that the publications are truly superb, including newsletters, and the handbooks are tremendous. And thanks from Robert and from all of us.
Thank you.
Also, just another update from the chat. We're welcomed by Terry from Atlanta. So hi Terry, it's so lovely to have you with us from so far away. And then another comment from Sonia saying a wonderful presentation. And Sonia is a teacher and a personal trainer who sees equalities play out in various different ways. So I'll keep updating nice feedback from the chat as we get it. But Greg, if you'd like to take it away, and Annette, back to you for sharing.
Please do, Greg. Yes, and thank you very much for doing your job, Rachel. Thank you. Lovely.
Yeah, thanks very much for such an informative presentation, Fazilet. It was really interesting, if a little bleak, as you said. My name is Greg. I'm the policy manager for the Traveller Movement. We advocate for ethnic, Roma, Gypsy and Traveller communities in the UK. I would wonder if it would be possible if either yourself or Rachel could share your contact details.
Yeah.
I won't take too much time upon this now because I'm aware of the time, but it would be great to link up on sort of coordination, collaboration on the COVID inquiry and the other sort of policy asks that you have at the moment.
Would love to, Greg. Thank you.
Perfect. And then just a second really quick question. I'm very conscious of the fact that you said it does fall to disabled people to have to implement the Equality Act, which is what we see in the case of ethnic discrimination as well. And at the risk of sort of feeding into that logic, I just wondered if Disability Rights had or were perhaps planning to develop any sort of guides or fact sheets on how disabled people can challenge their energy suppliers if they are sort of looking to move them onto a prepayment meter or not considering those circumstances that individuals might be in. Hopefully we won't need it because the government will ask, but in the absence of that, it would be really helpful if we could disseminate some of that information if it's there as well. And thanks again for all the information. Really, really helpful session.
No, it's a really good point, Greg. I think even if we don't produce that guidance, if we can point disabled people who read our newsletter to where it exists, because I think there's other people who are producing those kind of, I know the Greater London Assembly is producing a whole section of its website on the cost of living crisis and with a section for disabled people. Greater Manchester Coalition of Disabled People have recently done a survey on the cost of living crisis. So there's quite a lot going on out there, and perhaps one role we could have is, as you say, Greg, making sure we pull together the links to the best possible advice and information for disabled people.
Yes, is that, did you have a follow-up, Greg, or is that good enough for you for the moment? Or?
No, that's fine. Really helpful. Thank you.
I was just thinking, you did say that one of the most positive things that you could mention in all this gloom, Fazilet, was the allyship, the extending of it to people who are running food banks, to food poverty specifically, to allies, in other words. The big organisations are known, I presume, like MenCap and Mind and the different organisations that exist for specific types of disability. Presumably they're all coming together, are they, or is it?
Yes, I think very much so. I mean, I think there's coalitions now. It's much more usual to work in coalition with some of these big systemic issues. I think one of the things that you know, maybe we as disabled people need to think more about is actually, you know, to what extent do we need to maybe hold hands a bit more with people facing other forms of oppression? Because we tend to live in our boxes at the moment, don't we? Whether it's disability, race, sexual orientation. And I think it's some of the issues are systemic. They're not, you know, no one's getting a good deal really. So I think that it's definitely something that we've learned, I think, during the pandemic, because no one organisation could have the capacity to act alone. But I hope it'll continue, and we work to find more and more partners. I mean, already, you know, Greg mentioned allyship, and I think there's a lot that there might be differences, but there's a lot that we have common purpose on.
Yes. Rachel, is there someone else who's put a question who might want to put it themselves a minute?
We've had also, I just want to say, if anybody would like to ask a question and just unmute themselves to kind of make themselves known, then I welcome that. Just a couple of quick updates from the chat. Jess McQuail, hi Jess, from Just Fair. Actually, Jess, completely up to you. Do you want a moment to unmute yourself to talk about the evidence that you're collecting, or would you like me to relay it from the chat box?
Hi, I can quickly do that. Hi, Fazilet, it's Jess McQuail here. How are you?
Well, thank you.
It was a great presentation. Only if you've got time, Rachel, would you like me just to quickly say that?
Go for it. I think it's really useful for people to hear in case they want to be involved.
Okay, fantastic. Okay, so we already work with Fazilet and team. I work for Just Fair, which is a small specialist human rights charity, and we work on everyday rights, the right to food, right to social security and so on. And we've been commissioned by the Equality and Human Rights Commission to do this very big project, which is about holding the UK and Welsh governments to account on their human rights obligations. And right now we've got a call for evidence open for organisations like all the people on this call to get involved. And you don't have to create new evidence. You might already have evidence that you've collected over the last few years. They could be testimonies, they could be research pieces that you've done that essentially are about the UK or Welsh governments adherence, or as we've been hearing, non-adherence to their human rights obligations. So please do send those in. I've put the link to the information that we've put out recently on Twitter and to our webpage, and there's a email address for you to contact. But we're doing webinars, we're helping people write their submissions. It's a really important moment, and if you want to join together, it's specially designed for very small groups to get involved. So please do reach out if you want any further information. But I think Fazilet, we've already sent the info to your team separately, but and to yours, Rachel. So but any further information needed, the details are all on that web link, hopefully. Hope that helps.
I think that, can I just say that I think that the point Fazilet was making, and you're really making too, Jess, that it's not. It is about disability because there are special areas. Every aspect of equality, of course, has its own special needs and concerns. But the whole system, the whole structure, which ultimately lands on the EHRC for this kind of work, does need to be involved in working together. I mean, I'm thinking about the whole women's movement. So we live longer, we are going to experience disability more often. Every ethnic group, every group has older, has women of every colour. So this intersectional idea is clearly very, very important. And if you are sending it out to these other kinds of networks, I certainly would be in a position to help facilitate that on its rounds amongst the women's organisations. But there are other organisations like the Women's Resource Centre that has a lot of smaller groups and a lot of Black and ethnic minority groups. I don't know if the Travellers are members of that, for instance. I think our speaker's just gone, has he? But anyway, they could be reached maybe with some help like that. So it sounds like a really important project. Thank you.
If we have a moment, I've got a question that I'd like to ask, and I can see Charlie from Liberty here. So hi Charlie, it's great to have you, and I want to kind of ask a question that's about the Human Rights Act. So also, if anybody's not familiar with Liberty, Charlie, I don't know if you have any links or anything relevant that to pop in the chat, but Liberty are really doing brilliant campaigning work around the kind of dire state of events we find ourselves in concerning our Human Rights Act. And at René Cassin, we are about to produce a special kind of Jewish community briefing document, the aim of which is to circulate amongst all our supporters and people who don't normally kind of engage with human rights, to engage them in the kind of really pressing issues about campaigning to save our Human Rights Act, and to do everything we can to kind of mitigate the downfall of this government backsliding on our human rights. And I've been working across the violence against women and girls sector, and my colleague Esther has been working with them alongside Liberty and other leader organisations. And firstly, I just wondered if there were any comments that you could make, and I imagine that we kind of don't, we don't need to think too hard to consider what they might be, but any kind of particular ways in which this backsliding on our human rights and kind of our Human Rights Act, slipping through our fingers, the impacts that has on the people that you work with.
Yeah, sure. And Charlie, please come in, because you probably know more than me. But I think, just so many of the things I spoke about, whether it's, disabled people not getting the right care and support in their homes, not getting the right care and support in institutions, not receiving assistance through passenger assistance services at airports or train stations, not having the right to family life because, they're moved into institutions when they don't want to be. And particularly we see that with autistic people and people with learning disabilities. We know that whilst, supported living is good, we know that some are pretty much incarcerated on their own in special hospitals, with food being pushed through a hatch. So in all these examples are areas where I think the current Bill of Rights will weaken our ability as disabled people to protect ourselves from degrading treatment, or the right to family life, or the right to independent living. So I think for us, the notion that our rights need to be reduced because they're too onerous on some public institution is a very strange framing, when actually we're the people that are being discriminated against, we're the people that need support, so we can stand up to the big institutions. But Charlie, please take the floor, because I'm sure you could explain it much better than me.
Thank you very much, Fazilet, and thank you as well for this event and your talk. I think it was all really, really excellent, although, some worrying things in there, of course, and really anything that I would say right now would also be quite worrying as well. This new Bill of Rights bill, this rights removal bill, as we've been calling it, it would repeal the Human Rights Act, and so many of the changes it would make would affect, well, they would affect everybody, but they would affect disabled people, especially things like removing what's known as positive obligations, which is the duty on public authorities, which might be your local council, it might be a hospital, it might be things of that nature, to ensure that people's human rights are respected. I think things like that, it's the scope of that is so concerning. There's really so much in the bill that is very worrying for us on how it will impact upon disabled people. And in fact, tomorrow, Liberty, the British Institute of Human Rights, Inclusion London, and Disability Rights UK are actually involved as well, are holding a session on what the bill will mean for disability rights. So I'll put the details of that in the chat. Anyone interested can come along tomorrow.
That'd be great. And thanks for your contribution, Charlie. You didn't come along expecting to be up here with Fazilet and Annette, but it's obviously, you know, so very pressing and relevant. So thank you for that contribution. And just a note to everybody that I will these links, if you are unable to access them through the chat, I will send you all a follow-up email where I will try and round up all of these links and send them to you via email. So don't worry, you won't miss them. I just have a question that's in the chat. I know we've been going for a little while now, so thank you all for your continued participation, and thank you Fazilet and Annette. We've got a question here, and it might be something, Fazilet, that the answer is actually kind of more of a signposting situation. And we have a question here about do you know of any plans to improve adult support around the West Midlands area, mainly Birmingham? It's quite low, especially for somebody with ADHD and ASD who isn't really able to access support in that area. You know, this kind of sense that the Midlands areas get kind of often forgotten with these kinds of support provision. Do you know of any plans to improve that support at all?
No, I'm afraid I don't. I don't know if the Midlands is worse off than other areas. I mean, I sometimes think that obviously if you live in London or Manchester, maybe there's a bit more focus on some of these issues. But yeah, if it is bad in the Midlands, I don't know if there's any disabled people's organisations that we could work with at Disability Rights UK to really look at what's happening. So if you've got any organisations you want us to link with, we'll happily do that.
Lovely, thank you. And I think unless there are any other questions, and this is kind of your final opportunity to ask questions, I'll leave just a second and hand back to Annette. But if not, then I'll just say now that I would like to thank everybody for participating. We're really pleased with the turnout this afternoon. Thank you, Fazilet, for your insightful contributions, for being honest with us, and still for inspiring hope despite the bleakness of the landscape. And thank you to everyone at Disability Rights UK and all of the other DDPOs represented here for all of your vital advocacy. Thank you.
Rachel,
yeah,
I think somebody is wanting to ask a question.
Yes, we've got somebody else here. Would this person like to unmute themselves and ask, or would you like me to relay the question?
Unmute. Unmute. There we go.
And I'll apologise, and the came out in my name. I'm not asked a question. I'm Tom Griffiths. I'm a community organiser. I'll change that. It's very funny. I was rushing to do that, Rachel, before you shut down. So I've never happened before. So I ask a question. I have to retain that name. I'll be brief. It's just as a community organiser, I'm part of local and national networks working as an alliance to better challenge both governments and the energy companies about the huge increase in energy prices. It's not just about sharing, not just about challenging on human rights. It's how collectively, because I'm an advocate, better advocate for individuals or groups of people to say, they can't afford this. What are you going to do about it? And the better collective strength you can do in those arguments, it's not just as an individual phoning up behalf of one client, but you can say, this group of people cannot afford this. They're going to become homeless. Their family's going to be split apart. And the impact on disabled people is even greater, although it affects all people, especially poor people. But I think the thing about the energy crisis, it's going to gradually go up the scale. And once it does, the level of unrest and disturbance in Britain is going to increase. So I'd just like to wonder if both Disability Rights UK, if it already is doing stuff, and René Cassin can take part in these challenges and alliances, because the stronger it is, the more impact it will have.
Yes, I think that's a very
I don't
good
think that came out fully.
You've frozen, I think.
Oh, I'm sorry.
That's all right.
To everyone, excellent presentations. Thanks to all speakers.
I'm sorry, I don't know how much yet. I'm not on a great computer, I know that. Just as whether both René Cassin and Disability Rights UK can be part of these alliances for collective challenge on behalf of specific people.
Well, perhaps Fazilet and Rachel can comment on that. Can you?
Yes. So I'm sure we'd like to know more about other alliances. We've worked with Inclusion London and other disabled people's led organisations to create the Disability Poverty Campaign Group, because we wanted the disabled voice to be heard. But that doesn't mean we can't, the DPCG can't link with others. So, you know, if you want to link with our anti-poverty group that's looking at energy and the cost of living crisis, Rachel can just give you my email address and I'll put you in touch with the person working on that.
Thank you.
That sounds very good. And then I heard, was there somebody called Marie who was speaking and asking a question? I heard a voice over, as it were.
And Marie just said thank you in the chat.
Oh, yes.
Lovely. And I think kind of following on from Marie, because I don't think that there are any more questions. I'd just like to thank again everybody for participating, in particular to Fazilet and to Annette for another brilliant session of chairing. Annette's chaired, this is her second session that she's chaired so far, and it's always a really brilliant conversation. I will send you all an email in the next kind of half an hour or so with all of those links so you can stay up to date. In the meantime, please do search for us at René Cassin and Disability Rights UK online, and you'll be able to find our Twitter accounts to follow, and we've got an Instagram account and a Facebook account, and we keep everybody well updated. We are hoping to come back, in fact we're definitely going to be coming back with more Judith Trust Social Justice Series sessions on the horizon. As soon as those details are firmed up, we will pass them on and send them around with booking links, always free to join and likely always online or hybrid. So everybody that wants to join will be able to join us. Thank you all. Have an absolutely lovely rest of your day. It looks a bit grey outside, so I hope the sun pops back out again. And it was a pleasure. Thank you, everybody.
I'm just going to come back on Rachel because I said we would like to thank you, maybe at the end with a round of applause, while you're unmuting, if you can, everybody, so we can actually give Rachel a round of applause. I would like to say that what I'm taking away from this is the need to actually act, and act now as this Liz Truss comes in. I mean, today she was talking about immediate action on the energy crisis. It'll be interesting to see what she comes up with probably on Thursday. I'd also really like to stress what actually Tom Griffiths, you were saying about advocacy. We still need advocacy which go direct to ministers, not necessarily only around something that is very important, like the Human Rights Act, which needs changing, but has a longer term vision, perhaps, although it's getting shorter and shorter. But on the specific points that we've heard today, and again, I thoroughly agree that we need the groups like disability-led groups, like women-led groups in our, traveller-led groups. But we also do so much need to come together as collectives and lend a name even to a long list of signatories. It does reach a minister's desk and maybe has a bigger impact than without it. So finally, I want to thank Rachel for all the hard work she's put in it. She really has designed all of this, and she's an incredible person to work for because she's absolutely reliable, and she sends out brilliant briefs and lots of lovely information, and it's always spot on. So now I think, have you mostly, can you unmute everyone, and let's give Rachel a hand. Thank you, Rachel.
Thank you. Thank you.
There are those signs you can put up of hands.
Oh, that's lovely.
Yeah.
Thank you, Annette. Thank you. And thank you, Fazilet. And enjoy your afternoon, everybody. And hopefully we'll be together soon. Bye.
Bye.
Thank you, Fazilet.
Bye, Annette. Bye, everyone. Bye, Rachel.
Bye.